What's up, rookies? Welcome to our first pharmacy rotation reflection series. And to get started, I have Nicole. Nicole Colina is a pharmacy student from Touro University, California, my alma mater. And she's here to share her rotation, her acute care one rotation at a post rehabilitation facility. Welcome, Nicole. Thanks for being on.
Hi, thank you so much for having me. I'm so excited to be here.
All right. So can you start by telling us a little bit about yourself? Why pharmacy and where are you on that journey right now?
Okay, well, my name is Nicole. I am a P4 or fourth year student. Currently only have 4 rotations left until graduation.
Yay!
So I'm counting down the days. I did my undergrad in Arizona and I am now at Toro for grad school. And I chose pharmacy because I have always wanted to pursue a higher level of education, really understand medicine, and I love the interdisciplinary collaboration that we do.
Awesome, awesome, awesome. So now tell us more about this post rehabilitation site. Where is it located? What kind of services do they provide and so on? What can you tell us about this facility?
Sure. So as you mentioned, this was my acute care one rotation. It
Yes.
was at Kentfield Hospital post-acute. It is an LTAC or long-term care facility, a
Yes.
long-term acute care.
Yes.
And we are about a 50-bed facility. Our patients are very diverse, mostly neuro patients. So they range from post-TBI or traumatic brain injury to motor vehicle accident or a cerebrovascular accident.
Okay.
Our goal at Kentfield is to essentially bring them back to whatever baseline they're at to give them independence and regain functionality.
Okay, okay. So it's a long-term care acute facility. You have about, 50 beds. It's kind of busy. It's a busy facility, and you kind of help people transition, people who've had some kind of brain injury transition from the hospital to their home. And as a
Yes.
pharmacy student, what kind of responsibilities do you have there? What kind of help were they expecting from you?
Yeah, so I have always told my peers who wondered what life is like at an LTAC.
Yeah.
I've always thought our patients are essentially ICU level care patients, but they are stable enough that they don't need to be in the hospital, but not
Yes.
stable enough to be discharged to a SNF. So
Yes.
being
Yes.
ICU level care patients, we did a lot of anticoagulation. We
Mhm.
monitored INRs daily, laboratory values daily. We did a lot of heparin drips. We
Okay.
also did a lot of antimicrobial stewardship. A lot of our patients who already have a complex situation going on oftentimes
Okay.
would
Okay.
develop an infection. And so we
Okay.
would treat that.
Mm-hmm.
I also worked with our team with we had a lot of therapists, occupational therapists, respiratory therapists, and physical therapists.
Nice.
And we just worked hand in hand to get these patients to baseline.
Okay. Okay. So sounds like you have to have your anticoagulation on check as a student before getting started, as well as your antibiotic coverage, spectrum of activity and that kind of stuff. And
All this
you work in collaboration with several healthcare providers,
very
doctors,
close.
okay, physical therapists, nurses, which sounds like the perfect environment for a student to learn. So, during your rotation, did you encounter any specific challenges, any unique situation that made your rotation, that really tested your pharmacy skills?
Yeah, I think unique such experience in my day-to-day being at an LTAC. We would do rounds 3 times a week where we would spend anywhere from
Okay.
15, sometimes an hour, talking about a very complex patient. And so
Okay.
a common experience we would have is our patients who are not intubated and were undergoing some sort of physical therapy. Often our physical therapists would say during rounds, hey,
Mm-hmm.
patient John Doe is able to make this and this improvements, however, is running very tachycardic or perhaps hypotensive. So we dealt with a lot of altering antihypertensive medications. We also dealt with a lot of patients who perhaps were agitated or had a psych condition, and so there was a lot of valproic acid was a favorite drug of our
Yeah.
providers, so it's used off label for agitation, but
Mhm.
as we know, requires a lot of monitoring platelets, ammonia levels. We need to have
Mhm.
lactulose on board,
Mhm.
check on their mentation. So
Yeah.
there's a lot of monitoring on a day-to-day. For I got to know our 50 patients very, very closely. They stayed during the inspection for the most part of my 6 weeks. So I pretty much knew their faces and I knew their names. So I think that was really unique to an LTAC.
Absolutely, absolutely. So we're gonna get to that because the point of this video is to specifically shed a light on the activities that you as a pharmacy students are performing at that rotation site so that students headed there are familiar with it and know what to study so they can better perform and better interact with the patients and the healthcare team. You did mention valproic acid, you did mention antibiotics and anticoagulants. So for our listeners who might be preparing for a rotation at this particular site, um, what advice would you give them to make the most out of their rotation there? And before you answer the question, start by stating exactly the name of the rotation site in case they want to go and look that up, and then go on with what advice do you have in terms of where to study, what to study, and questions that they may be prepared to ask, and how do students interact overall with the healthcare team. What advice do you have pretty much for them?
Yeah, so again, my 6 week rotation was at Kentfield Hospital, and
Mm-hmm.
it's an LTAC, a long-term acute care. And I would say prior to starting this rotation, as you mentioned, be very fluent in your anticoagulation. I
Yeah.
did warfarin monitoring daily.
Yeah.
I learned so much affects INR, so very much. And so we looked at that on a day-to-day basis. I would say be very familiar and fluent with your vancomycin calculations, assessing peak
Okay.
and trough, when to
Okay.
place
Okay.
orders for labs,
Mm-hmm.
assessing not only are we at goal, but was the peak and trough drawn correctly.
Okay.
I would also say be very familiar with your spectrum of activity. Specifically, we had patients
Mm-hmm.
um, who were septic, and sometimes you would have a septic shock episode. Um, we often had pneumonia, HAP, and VAP because a lot of our patients were ventilated. So be very fluent with management of that. And also be very fluent with psych drugs. We have a lot of off-label uses for valproic acid. I mentioned amantadine, among other things. So be specifically familiar with dosages and monitoring parameters.
Hmm. Man, you said a lot, and I'm gonna try and break it down in the show notes before posting it for our students to have access to. And again, the name of the rehabilitation facility,
Was Kentfield Hospital.
Kentifield Hospital in Marin County, out here
Yes.
in California. You did mention knowing your 50 patients very well over the course of your 6 week rotation. Can you share an experience with one of the patients that stood out to you and that kind of validated your choice of becoming a pharmacist, and or the impact you're having as a pharmacy student on these experiences?
Yeah, so there was one particular patient who often had his family over all the time, and so I got to know them well. And this particular family was very involved in their patients' care. And I would often, them being a smaller facility, I knew them on a first name basis. We would see each other physically in the hallways, and they would actually ask questions about their father's care. And so I actually got to break down at a patient-friendly level, this is why we're doing this. This drug is being used for this, and they really did appreciate that. I also was able to develop a relationship with this patient. Sadly, towards the end of my rotation, the patient did pass, and it did remind me that life is so incredibly short and fragile. And I was just really grateful to have had a relationship with the family, and they were very grateful to our facility and just the level of care and attention that we provided.
Oh man, that is not a happy ending, right, to this story. But um it just shows that pharmacists can have an impact in patients' lives, not just by taking care of their medications. You sure did that, and you broke it down to them in layman's term, because in the busy world of healthcare, people don't have enough time to sit down with the patients and make them understand in layman's term what their medications are for and what they're using, and getting the family involved. So that really means a lot to a lot of patients. And I love, that's one of the things I like about pharmacy too, is being able to develop these relationships with the patients and their families. And although the patient didn't end up going home, you got a good experience out of it. You learn from it, not just the patient care aspect of it, but the life aspect of it, that life is just passes us by. And as a pharmacist, you do make an impact, because at the end, what they're gonna remember is the impact that you have made, right? In your family's life, in your patient's life. And I really appreciate you coming on and sharing this, because you were on a rotation with me, and when you mentioned that you were going on the post acute um a type of post-acute rehabilitation facility for your rotation, I wasn't really. Are we still on? Shush. Okay. So when you mentioned that you were going on this setting, I didn't remember ever having a student going through that kind of rotation. So I thought it would be a unique experience for pharmacy students to learn about, in terms of, this kind of thing is available. People go to hospitals and they're not stable enough to go home or to a SNF. And then there's this thing called long-term acute care facility, where patients can be out of the hospital but still yet receive this acute care type of setting. So students, if you're gonna go on rotations, is you're gonna be prepared to do ICU rounds, antimicrobial stewardships, antimicrobial dosing, anticoagulation dosing. You mentioned warfarin, you mentioned heparin, you mentioned even psychotics and anti-epileptics. You mentioned vaporic acid. So these are all things that we don't students don't really, especially with vaporic acid, don't think about firsthand when I think about an acute care rotation. So it's good to know. And thank you for coming on. And students, if you have any questions for Nicole about this rotation, don't hesitate to reach out to me and I'll connect you with her. Thank you again, Nicole, for coming on. Any last words?
No, just a word of advice to students. I think just you should go in excited and willing to learn.
Yeah,
And I think one thing I would wish someone had told me is it's all right if you don't know everything, but you know more than you are capable. You know more than you give
yeah,
yourself credit for. You're
yeah,
capable of so much learning. So be prepared to grow.
yeah. Because we're always growing. Everybody is growing. If you're not growing, you need to change environments. And I like what you said about it's okay if you don't know. You're a student. We know that you don't know, and then we're here to teach you. That should be the mindset of the preceptors. All right, everyone. If you have any questions, feel free to reach out. And until our next episode, stay blessed. Love you. Bye bye.